I'm cancer physical therapy specialist, Dr. Leslie Waltke, and I was supposed to shoot a video today on sentinel lymph node biopsy, but you know what? It's been a really, really crappy day, and I honestly just don't feel like doing that anymore. I just learned a couple of hours ago that a young woman that I know just died of cancer. And I'm sad and I'm angry and everything just feels really heavy. This young woman was a part of a large cancer survivor group that I helped found and lead. So I certainly feel pain and loss, my pain and loss, but the loss felt amongst this particular cancer survivor group is really quite profound. They lost a friend, they lost a sister, a teammate, and they lost her to a disease that they too have or have had. And that has to feel horrible and horrifying. And it's complicated. So you know what? That's what we're going to be talking about in the recovery room today. Often when one is diagnosed with cancer, they become part of a network of other cancer survivors, whether it's a support group, a community group, or in this case, a triathlon training group specifically for women cancer survivors. These groups are fairly common because they hold so much value for survivors. Camaraderie, understanding, shared experience. But people die of cancer, and it can send shockwaves through these groups when a vital member dies. In addition to the loss and grief of losing someone that you care about, if you yourself are a cancer survivor, you may have to then contend with a whole another slew of emotions that can include fear, anger, panic, insecurity, and survivor guilt. And I'm going to begin by saying it's absolutely okay and normal to feel those things. It's okay to be angry. It's okay to be resentful and scared and say, thank God it wasn't me. Those are totally normal responses to this kind of trauma. And know that even if you both had lung cancer, or you both had colon cancer, or both had breast cancer, that there are different kinds of diseases, different stages, different subtypes, and people just respond differently to treatment. So just because this happened to this person doesn't necessarily mean it's going to happen to you. Find someone to talk with. Don't suffer alone. If people don't know you're hurting, they can't help you. If you are a cancer survivor, you most likely know how to plow through feeling crappy and just moving on, and the world doesn't know about it. Sometimes that's a good skill to have, but not in this situation. So please, reach out to your significant other, reach out to a good friend or a couple of good friends, reach out to your clergy, reach out to your primary care physician. And if you are really scared with how you feel, you pick up the phone and you call 911. All you need to do is say, I am scared about how I feel, and they will take care of it from there. You may remember the moments immediately following when you found out that someone that you care about, another fellow cancer survivor, died. You may find yourself bargaining, saying, oh God, I promise I will eat better, I will drink less, I'll exercise more, whatever it is. I challenge you to write that stuff down. Put it in your phone, put it in your calendar for 1 month, 3 months, 6 months, 12 months, to hold you to that bargaining feeling that you feel right now. Use this agony and this pain and this loss to propel something good for you and your health. Your loved one who just died would love that. Also, please discuss your fear of recurrence with your family, your friends, and certainly your medical oncology team. 99% of the people that find out what their cancer recurrence risk is will eventually say it's better to know. It helps you cope, it helps you plan, it helps you decrease fear, literally. Talking about these fears does not certainly decrease risk of recurrence, but it doesn't increase risk of recurrence. Talking about bad things does not make them more likely to happen, and it helps you plan, feel more secure, and get things in order so you can feel less stress about it. That is honestly the way it works. So please talk with your medical oncology team about that. from my professional side, from a clinical standpoint anyway, I, in situations like this, rely on a quote from Patch Adams, who was a physician years ago, who was one of the first physicians to really bring in humanity and love and laughter into healthcare. And that quote is, if you treat a disease, you're going to win some and you're going to lose some. But if you treat a person, you will never, ever lose. So that's what I rely on in times like these. Now, personally, and I know you will probably agree to this too, with your loved one who you may have just lost, is it as cheesy as it sounds, it's true. It's better to have loved and to have lost than never to have loved at all. And I can promise you that 100% of the people in my group that are really hurting right now, not one of them would trade this pain for not having had the opportunity to get to know and share the love and the laughter and the kinship of this young woman that we just lost. And I know that she would want me right here still doing this. So that's what I'm going to continue to try to find a way to do. I'm Dr. Leslie Waltke. Please take good care of yourself and your loved ones. And let's talk again soon.